times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague Dr. Kate on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month. It's quite alarming, the rates of loss of vision worldwide, and in the developing countries also very, very high. Globally, we have 20 million people living with glaucoma. And in the developing countries, I'm certainly sure that it's also very high. But unfortunately, we don't have so much number of such, as in we don't have numbers given to us. This is because most people do not go for eye check-up. In Nigeria, about 1.2 million persons are living with glaucoma. Those are people that actually went to the hospital and realized they have glaucoma. One may ask, what's glaucoma and what are we talking about? Firstly, before I continue, let me introduce myself. I am Dr. Amy Momoin Helto, and here with us is...
I'm Dr. Keith Primer. It's always a pleasure being on the show with you, Dr. Amy. Welcome to Celebration TV Health Talks today.
Welcome. So, as I was saying, you may ask, what's glaucoma and what are we talking about? Glaucoma, eye diseases that causes loss of vision, permanent loss of vision due to the destruction of the eyes, in particular the optic nerve and the retina.
The eye is one of the most neglected parts of the body.
Yeah.
And you know, apart from just sight, the eye plays very vital role in the body. That's why you see people who are sight challenged usually feel very devastated. Yeah. It could tell on them, their families, and also the society. Apart from just seeing, the eyes help in the display of emotions, and its importance cannot be overemphasized. Glaucoma is the second leading cause of blindness worldwide. Yeah. The first is cataract. Yeah. But the beautiful thing about cataract is that cataract is reversible blindness. But in glaucoma, once the damage has been done, it is usually irreversible. Yeah, and it's about the leading cause of irreversible blindness worldwide. Yeah. Yes.
And talking about the anatomy of the eye, that is very important, because we have to know our eyes and to know what causes destruction and all.
Yeah, the eyes, if you look at the structure of the eyes, you see it's globe shape. Yeah, it has some fluid inside the eye that maintains the contour, the globular nature of the eye. Yeah, you have the white part of the eye that you can see. You have the black. Then the posterior part of the eye has fluid, the aqueous humor. That fluid that's in the eye maintains the shape and also gives nutrients to the eye. Yeah, and then there's a normal pressure that is maintained by this fluid, because the fluid is produced. As it is produced, some of them flows out. More is produced on a continual basis to nourish the eye and make it effective. Anything that will raise the pressure of the eye unusually will start to cause damage to structures of the eye.
Yes, and in the case of glaucoma, the optic nerve is actually what? Damaged.
Yeah, when we talk about nerve, it's like your telephone wire, the cord that connects your phone, the normal landline phones, or your normal wire, anything. It's like also what transmits, it's what transmits information from the eye to the brain. So what you see with your eyes is interpreted by the brain
Yeah.
when the nerve is able to carry this information to the brain. Anything that damages this nerve, even when you look and see, impulse does not go to the brain and the person will become blind. So glaucoma is a condition that damages that nerve or that wire in quote that transmits signals to the brain.
We can also relate it to the bulb and the light.
Yeah.
You know the wire that's it's in the bulb. Before we put on the switch,
there must be a wire connecting something.
And that wire it's related to it's like
the nerve now.
Yes,
the
like
optic nerve now. Yeah.
And the bulb is like the eye.
Yeah.
So if the wire is cut and you put on the switch,
nothing will work.
No,
yeah.
the light will not see.
So that's how it goes.
That's how it
yeah.
goes.
So anything that will destroy the optic nerve of the eye will lead to what we call glaucoma.
Okay, there are so many risk factors. There are some risk factors rather that one can see in the case of glaucoma. The risk factors are those things that makes one or can makes one prone rather to glaucoma. Family history is one of them. Sometimes for some people, it runs in their family.
Yeah.
And so imagine a father will have it, the children have it. That's why most times when we notice a father has a glaucoma, they'll ask you, please, do you have brothers, you have sisters, where's your mom?
Yeah,
no, brothers, sisters, rather.
It's an important question that every doctor will ask you. Once you come with any problem, the first question is, have you got this in your family? Exactly. Yeah. We know that glaucoma has a high incidence of being inherited. Yeah. So so one of the commonest risk factor is that family history. Yes. Yeah.
And also the age, it is seen usually in the elderly, the open angle one. We usually talk about type, you understand?
From 40 years and all. You see, the deception in this is when we tell people that it is a disease of the aged, they feel that it is only when you are old that you can pick it up. Glaucoma is commoner in ages 40 and above. True. However, we have seen children born with glaucoma. Yes. There's congenital glaucoma. Yeah. There's the juvenile glaucoma. So it can affect any age group. However, those above 40 are at a higher risk of being affected with glaucoma.
Yeah. Then also race, some certain people, group of people.
Blacks generally are at high risk. Of course, that's why we have a high incidence. You know, the figures you gave, it's unfortunate that in this part of the world, we really do not have statistics.
Yeah, because, you know,
the incidence is far higher,
it's higher.
Than what you give. And because our health-seeking behavior is so not, many people would not even come to the hospital, and some would just remain at home even with sight challenges.
Until it's worse and they've lost their sight. Some of them might not even come even when lost their sight.
It's quite unfortunate. That's why glaucoma is more aggressive also in blacks compared to the Caucasians. Okay. Yeah. So the incidence is higher in blacks. It's also more aggressive. So once an individual is with diagnosed with glaucoma, the chances that it will progress rapidly is higher.
And also, drugs like steroids can actually induce glaucoma.
Yeah, so they like to know what steroids are. Steroids are medications that people use. A lot of them, many people use steroids for a lot of things. Some use them for pain, and some for some other disease conditions. Yeah, high dose steroids over time could also precipitate that. And other eye conditions too. Okay. Yeah. People who are far-sighted or short-sighted, they also have an increased risk of coming down with glaucoma. Diabetes, I've said hypertension. And then there is what we call ocular hypertension. That's the person may not have systemic hypertension. He may not have high blood pressure, but the pressure in the eye,
pressure. Yes,
so
once is a risk.
Exactly. Ocular hypertension is also a risk of coming down with glaucoma.
Exactly. Yeah. So talking about the types of glaucoma. Okay, before I talk about the types of glaucoma, in our screen we have a number. Please feel free to call us and ask questions about glaucoma and any other medical condition you want us to explain or to tell you about. Any medical advice, feel free to call us on the number in the screen. Thank you.
All right.
So
you were going to talk about the types of glaucoma.
Generally, there are 3 types of glaucoma. There's the open angle glaucoma, closed angle glaucoma, and normal pressure glaucoma. In the open angle glaucoma, that one is we call it also the chronic glaucoma because it takes a long time for such person to end up having what? The
loss of sight.
Loss of sight, yeah.
You know, like when I was talking about the anatomy of the eye, you know, there is a place, like we said now, the eye contains water, the aqueous humor.
Yes.
That water, we've talked about what it does. Normally, when it has served this function, it will flow out.
It's supposed to flow out.
Yeah, it flows out of the eye. More of them is produced.
Exactly.
So the chamber through which it flows is usually open.
Yeah.
It's just like your drainage in the bathroom, in the kitchen. You know, your floor drain.
You see some little
so it flows through it,
yes.
and then more of them is produced. In the open angle glaucoma, when you look at the eye, the drain
is open.
It seems opened.
But the flow is
slow. Either slow or there's an obstruction far away from that point.
Yes, but we cannot see the obstruction. So what we see is that it's not flowing well.
So you just say that somebody has what is called an open angle glaucoma. Yeah.
But in the closed angle glaucoma, in this case, there is an obstruction. You see that it's blocked. That passage at which that stuff we just talk about, the holes.
The drains
call
are
it
blocked.
The call it
the meshwork.
Yeah. So you can see that it's blocked. As such, what happens?
The fluid cannot flow. It continues to gather. The pressure continues to increase, and then it starts to press on the nerve that supplies the eye.
Then in the normal pressure glaucoma, there is no what. The pressure is okay and all, but you are not seeing so much. There's not so much fluid and all, but the optic nerve still continues
to be damaged.
Yeah.
Of course, most of them look at genetics, the family history of this disease would cause that.
And you know, the types actually linked to the clinical features.
Yeah.
For example, let's talk about the closed angle glaucoma, the one that you can see that when the doctor sees it, you can see that there is an obstruction. Such persons come to the hospital with what? In fact, the person notices pain, intense pain. Usually, they are sitting down freely, watching TV, and maybe everywhere is dark, and they are watching TV in a dim light, and they are straining their eyes. Lo and behold, oh my!
And there's just a sharp. That one will come. Pain. Yeah, the acute angle closure glaucoma is the type that just starts once.
Or abrupt upset, suddenly it just starts.
But basically, these people may already have any eye condition that may not have been diagnosed. Yeah. It could be short sight, it could be long sight.
These ones can actually if that's a risk factor, it can induce or precipitate this
an acute closure. So when the person is looking at things, especially maybe in dim light, reading under dim light or watching TV, all of a sudden the angle just closes,
closes,
and then a lot of water gathers, a lot of pressure, so much pain. Blindness will start setting in.
And such persons come with redness of eyes. Their eyes are actually red. They have these painful eyes. Their eyes are red. They are painful. They feel like vomiting. They have nausea.
It's an acute thing. So they will have the other systemic symptoms accompanying the glaucoma.
It is very important to know that this is a medical emergency. Yeah. Please, if you notice this, listen very carefully. If you notice these features, or you have a family friend or a family person, a family relative or so that have these features, do not sit at home, put an ice in your, put an ice cube or ice block in the eye.
It's not time for applying eye drops.
Go straight to the clinic because this is a medical emergency. Any little time matters. If such person stays at home, he or she might lose the sight. So you have to hurry up to the hospital.
Yeah, in acute angle closure, within a week, if no intervention is done, the person may become irreversibly blind. Exactly. Yeah, that's how unfortunate it could be.
But like in the open angle glaucoma, yes.
That one, it's a long-term thing.
Thank you.
They are gradually, they see, they feel they see.
Yeah.
I had somebody came into Jehovah the Doctor a few months ago. He was brought by the wife. The man didn't even care. He felt he was seeing. But the woman came because he felt that there were forces pursuing the husband, making him get involved with accidents. In the last 3 months, he had 4 accidents. Either people will run into his car or he will run into people. And then he came for prayers, for protection per se. And while we were talking, I just saw somebody who had an open angle glaucoma. And I started asking questions. The man could see the straight vision, it was good. But the peripheral vision was almost gone, completely gone.
It's like a tunnel, looking through a tunnel. You can only see one person, you don't see around.
And that's the deception in glaucoma. Because people tell you that they can see. So they don't think there's a need to see a doctor. But once they start bumping into objects, that's when it becomes clear to them that there's a problem.
At that time, most of the nerves could have been
the damage is already has been done. So what you can just do at that point is to prevent further damage.
And this open angle glaucoma, there is no clinical feature, no sign, no symptom. Unlike the open, the closed angle that comes with pain and all. This one, you just feel you're okay, and lo and behold, you don't know that your eyesight is going just like that. It's a silent. That's what it's called. It's a silent thief
of sight.
Silently stealing your sight. So that's why it's important that we beg us all, please always go for eye check. Even though you are okay, you feel you are okay, go see the ophthalmologist or the optometrist. So that we say
once you are 40 years and above, whether you have a family risk factor for eye disease or not, you have to do a comprehensive eye check at least once every 2 years. Depending on your condition. If you have a family history, then every year will be fine. If there's no family history, once every 2 years. Because there are some sinister things that could be happening in the eye that you will not know.
You know, in the developed countries, what they do when the person comes to the clinic, wants to start school, you know what happens?
Of course, they do general eye screening now when they want to start. But here, unfortunately, most of them are not done, and people will not usually know that they have eye challenges.
Okay, I just remember this. When we went for outreach, the Jehovah the Doctor outreach. Okay. Sorry. For now, we are going to take a break. And when we come back, we'll say more. We'll tell you more about glaucoma. So, hope to see you very soon. Stay tuned. Don't leave your TV sets. Thank you. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague, Dr. Keats, on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague, Dr. Keats, on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. As kids, as teens. Sorry for the abrupt break in transmission, and welcome back. Remember, we always are waiting your calls. So please, if you have any question concerning glaucoma or any other medical issues, feel free to call us. We are always here to hear from you and to counsel you on various medical issues. Talking about the clinical features of the open angle glaucoma. Remember we talked about this, tunnel vision is another aspect, and we also said that it is a what? It is silent.
It's silent. You will not. It just does not come with any symptoms, and you will not know that you're having any eye challenges until you become, in quote, blind. Yeah. And
in this case, your person might not even know that he has, as you said, person might not even know that he has any eye issue.
They will still feel that they are still seeing. Okay, on the board now, on the screen. Okay, that's the optic nerve there. We said that's the connection between the eye and the brain. It's like the wire that carries signals. You know, once you cut off the wire that carries signals, all signals are gone.
And so when the pressure comes in, due to the increase of this fluid, this aqueous humor, it goes towards that optic nerve and damages
and causes damage over time. Although we also said that there are some people who do not even have a high pressure, and yet they are still having damage to the eye, when either because the drainage pipe is
totally blocked, that is in closed angle glaucoma, or even the drainage pipe may be open, and yet they are still coming down with blindness. It depends anyways, but the basic thing is that glaucoma is a silent thief of sight, and that the best form of prevention in glaucoma is early detection. You know, it's just, glaucoma is just like an issue when there's a fire in a building. So when there's a fire in the building, for example, and the firefighter comes in and what? Puts off the fire. But what happens to the building?
The damage done already will still remain.
Okay, there's a call coming on now. Hello, where are you calling from? And what's your name, please? Hello, can you hear me? Okay. We can't hear the caller, and we hope that he calls back or she calls back. So as we're saying concerning...
Okay, I think it's still on.
Okay.
Hello? All right, I think we lost that call.
All right. Okay, as we're saying, concerning the clinical features, we talked about glaucoma being like a house. Like there's a fire, and the firefighter comes and put it off. But what happens? Yes, the destruction has been stopped. But what happens to the house?
Anyone that's been destroyed already remains destroyed, and they are usually irreversible. So that's why we say that comprehensive eye check. You know, there's one funny thing. You know, in the treatment of eyes, we have 3 groups of people that attend to eye challenges. But in this part of the world, we really do not know. There's the optician on one side, there's the optometrist on one side, and there's the ophthalmologist. When people tell you that, I've actually asked some people that, have you seen a doctor for your eye challenges? They went to make glasses. Most time they have gone to see the optician. Who will frame. The job of the optician is a technician who frames glasses. They can do glasses for you, but without being able to diagnose what is wrong with you, and you can keep wearing the glasses. The optometrist can make a diagnosis of what is wrong with you. They can look into your eyes and pick out what your problem is, and if it's what requires glasses, they can recommend glasses to be made by the optician.
And if they notice,
if it's something that requires surgery, they will send to the ophthalmologist, who is a consultant in eyes. That's why when we say do a comprehensive eye check, they are an ophthalmologist or an optometrist is looking at the eyes. They'll first look at the outer part, the status of your cornea, the status of your retina. They'll measure the pressure in the eye. Because that's what's going to cause damage over time. Once the pressure in the eye raises above normal.
So now we are now talking now about what the
how to prevent this, because you know that you basically cannot prevent glaucoma. If it's running in your family, you are definitely going to have it, in quote.
But you can actually
nip it in the bud.
Yes, you can halt its progression.
Yeah, exactly. So once you pick it early enough, you stop it from progressing.
Exactly.
But once you don't pick it early, it will do some damage. And you know, even we found out that more than 15% of people who are even on glaucoma treatment will still end up blind, unfortunately. Yeah, that's because no matter what you are doing at that point, whether it's surgery, whether it's eye drops, whether it's medications, many of them still will become blind over time.
Yes, but however, we have to put this in consideration. Those that are not compliant with medication, you know that they have to be on medication for life.
Yes, for life.
Being on medication for life is not fun at all.
Yeah. Okay, so there's a question. They say, what are the causes of glaucoma? Like we said earlier, we have risk. We know risk factors. There are some things that would happen to an individual that will make him more likely to have glaucoma. It could be running in the family. It could be age. It could be because you are black, you are a Afro-American. Yeah, it increases your risk.
Even steroid, when you take steroid
medication
for a
then injuries to the eyes generally, any trauma to the eye can cause blockade of the meshwork and increase your chances of coming down with glaucoma. Then people who have diabetes, who have hypertension, there are people who have other eye conditions, short sight, long sight, they have increased chances of coming down with glaucoma. Yeah.
So there's a question concerning symptoms.
Is it symptoms of glaucoma? Okay.
I will treated that earlier on. But related the symptoms to the types.
Yeah.
Like what we said earlier on, for the closed angle glaucoma, then you can see the symptoms, the red eyes, the pain, nausea, and all. But for the open angle glaucoma, which usually is chronic because it stays the blindness,
which is the commonest one of the glaucomas actually.
The blindness is not like abrupt like the open angle one. Such they don't have
any complaint.
No complaint. They go on with their life, but to realize
they keep going blind,
because they are losing their eyesight little by little. So that when they get to the old age, before they are blind. So that's why risk factor is old age, because such person most of them have had it when they were young, but
starts manifesting after 40 years.
Exactly, and they didn't go, and they couldn't get diagnosed on time because of no eye checkup, which occurs most time in developing countries.
So it depends on the type of glaucoma that would make you have a particular symptom or not. Yeah.
Even in the
So that's why also in the comprehensive eye check, they'll also look at your peripheral vision to see whether you are seeing from the sides. It's not to see from your
front, because such person, they have tunnel vision. Just imagine you carrying a paper and looking through the paper. You just see only straight. That is it.
That's what they see.
That's the tunnel vision. They don't know, if they look here, they don't know who's
beside them.
Like me, I can look here and know that Dr. Kit is by my side, but they will not even know if there's a Dr. Kit there. They'll just look, they'll just look straight and say,
and they usually will not lay any complaints until they start. Maybe if the person drives, they start bashing people. Or people start bashing them because they may not see from the side when they want to make a turn, or when they start walking, they start hitting objects on the way.
Yeah, or when it's now almost in their final stage, when the eyes have
when the nerves are gone. Quite unfortunate. It says, okay, how can it be prevented? We have said that before now, that for you to prevent glaucoma, you have to take away the risk factors. Of course, some of the risk factors are not modifiable. Like once you already have a family history, you have a family history. You can't change family. Once you are 40 and above, you are 40 and above. You can't become young again. You can modify those. But there are a few of them that you can modify. Like if you have, if you are on medications that causes steroids, that causes glaucoma, you stop, except they are prescribed by a physician.
But the physician can find a way of...
they can always find a way to change the drugs and all that. So if it's medication that you're on that will cause it, you change. Steroid eye drops is a common cause of glaucoma. And people just, in this part of the world where people can walk to a patent medicine shop and buy eye drop.
Just get eye drop and put in there.
So it's quite unfortunate because when they do that, they may not have this condition already, but the steroid eye drop will now precipitate such. So staying away from medications are good, because then if the people have a baseline eye problem before, maybe a short sight, a long sight, they wear corrective lens.
Exactly.
Yeah, it would help. And then staying away from dim lights, especially for the acute angle closure.
Yes.
When people strain in dim light, it could just precipitate a glaucomatous attack and block the drain, and then the person starts having challenges. If you are diabetic, control blood sugar. If you have high blood pressure, control the blood pressure. Okay, that's a photograph of the heady eyes and the glaucomatous eye. You can see that the dark spot of one is clear, while the other one has now become because of increased pressure happening inside the eye, and it's causing damage to that particular eyeball. Yeah.
As you said earlier on, it can be what? Some of them are preventable, talking about the prevention, while others are not preventable. For those that are not preventable, early detection is key. When it's detected early, then medications can be given, surgeries can also be done, and the person might be abstained freely throughout his lifetime without becoming.
So it depends on when it is peaked. That one is a key factor.
Exactly.
Yeah, when it is peaked early enough, you try to slow down the process. But in this part, you see people even coming down with challenges of the eye. The hospital is the last place to go to. Yeah, they will have visited patent medicine shop. No, there's usually a circle. They first visit a patent medicine. They visit a nurse around their house. That's the first one. Yeah. When the nurse fails, they now go to a chemist. When that one fails, they now come to a hospital.
Yes.
And when they are very impatient when they come to the hospital. That's the truth. Because they want express service. Like, give it to me, let me leave.
I want to see, give it to me.
And then we know that, and for some of them, they'll just spiritualize it from the onset. Like I told you about that man who came because he was under attack. Yeah, he was. They sent accident. That's the language the wife used. Say they have sent accident to my husband.
Wow.
Okay, I'm like, why? He said he has been involved in accidents. Over the last 3 months, he has had 4 accidents. How did they happen? It's either we run into somebody, bike, or another car will run into him. Yeah. And when I examined, the peripheral vision was gone. So the man could see, but he could not see from the sides. Because the nerve damage will gradually occur from the sides until it catches up with the central vision, and then the whole eyesight is gone.
But this eye loss is really quite alarming, like seriously. And we talked about glaucoma, which is the second leading cause of what?
Of blindness worldwide.
And the first leading cause of what? Irreversible.
No, of reversible blindness. Cataract.
Glaucoma.
Glaucoma is the first cause of irreversible blindness worldwide. Yeah.
Why cataract is it what?
Is reversible.
Cause of the what? Reversible blindness.
You see, you can't but imagine the devastating effect of poor sight. Yeah. You have seen when an individual cannot see, you can't but imagine what they go through.
And
their families will be affected. Of course, their jobs will be affected in most ways, especially where you don't have an occupational therapist that can change your job.
Yeah. Looking at the picture that I just showed now, yes, the healthy eyes and the glaucomatous eyes, we've seen it. And a previous picture showed the cataract, the eyes of cataract and glaucoma. Yes.
Okay.
It was previously shown.
All right.
What surprised me, I just want to debate a little. What surprised me is that you see people, thousands of people living with cataract, and they're blind. And they're blind. Okay. When I see them, like, hello.
That one is reversible. If it's cataract, they can do surgery. But would you blame them? Probably financial constraint could be one of them in this part of the world. We really have to.
Also.
Yeah, information is key, but we know that financial constraint for them could just be one of the reasons they don't do that. Yeah. So there are, you know, when we talk about people going blind, the effect that it also has even on the society, because there's a reduction in manpower.
Yes.
Yeah, people who are supposed to be active and contributing to the economy are going blind because of conditions such as this. Yeah. So it's really, it's traumatic for them to cope with. If you have anybody who is blind, you kind of want to put yourself in their shoes and see what they go through. Yeah.
It's really traumatic. So, okay, talking about the complication, we all know that complication is what?
It's irreversible blindness. Yeah. But people really need to start watching for their eyes. Yes. Yeah, there are general things that you could do to protect your eyes. You know, in this part of the world, there's so much dust, there's so much wind. Yeah. Yeah, there's so much dirt around. Of course, they won't contribute to glaucoma, but they also contribute to other eye problems that people have. Sure. Cataract, of course, is due to because of age. Yes. People age, maybe drugs, trauma to the eye. Yeah. Some could just be a pterygium. You see growth appearing on the eyes of people because of prolonged exposure to dust and sun and wind. Sure. So we counsel people to wear dark shades on their eyes. It could help to protect them from them. Then some we tell them there are some eye exercises that people can do that can strengthen their eyes, that even when they age. Yeah. We have what we call the 20-20-20. You know, in this age now, people watch screens. You operate your laptop 24. People read from laptops now, read from phones and all that. We advise that to limit eye strain. When you look at your screens for 20 minutes, take away your eyes for 20 seconds. Yeah. Look at an object far away, 20 feet away. So that's 20-20-20. 20 minutes on your phone or your laptop, 20 seconds away from your phone, looking at an object 20 feet away or 6 meters away. It will have to recondition the eye and make you fit enough to look at the screen again. So please, we advise you all. Yeah. Because if you don't, it will put a strain on the eye. With recurrent straining of the eye, your risk of coming down with an acute angle closure glaucoma will increase. Sure. Yeah. So there are also eye exercises to strengthen the muscles that people can as well do. We have the pencil push-up. You can hold the pencil your arm's length away. Look at the tip of the pencil. Bring it close to your nostrils. Take it away. Yeah. It helps to strengthen the muscles of the eye and makes you see. Because it's a beautiful thing that after God has blessed you, you are able to see until old age. Yes, so that's what we all pray for. Yeah. Yeah, sure. Our advice to viewers is please always go for a checkup. Check your eye. Comprehensive eye check. Go for comprehensive. Be specific. Because many of them will go and see an optician and collect glasses. Do not just go see an optician and collect glasses. Anytime you have this issue with eye, you notice that you can't see well or anything, do not just go collect glasses. Go for comprehensive eye checkup in the ophthalmologist, optometrist. Please do that. And always remember that the eyes are the windows to the soul, and the light to the body. Yes. If you don't protect the eye, it's going to come down with devastating effects. You can wear sunshades if you stay under very hot weather conditions. As much as you can, protect your eyes. As much as you can, check your eyes for any imminent problems that will arise. Okay. So once more, thank you very much for staying tuned with us, and I hope you enjoy this educative talk on glaucoma. I am Dr. Momo Imushuke, Dr. Amy Momo. And I remain Dr. Brahma Kid. Yes. Thank you for staying with us. Thank you very much. Bye-bye. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult.
to explain the connection. It definitely takes a healthy budget to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague Dr. Kate on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every 4th